Good morning, good afternoon, good evening. My name's Steve Godfrey. I'm Director of Policy at the Global Alliance for Improved Nutrition, and I'll be facilitating the session today. Welcome to this dialogue session for the ECHO meetings in Brussels. Our topic's fighting malnutrition to strengthen the impact of local responders before and during humanitarian crises. And we've got three really experienced representatives of organizations and companies that are heavily involved in that area. So we're going to try and keep this discussion very pragmatic, focusing on the challenges and opportunities. A little bit about the context. I think everybody knows last year was a big year for hunger and malnutrition. On the positive side, we had the Food Systems Summit, which brought a whole new layer of thinking to how to integrate issues like malnutrition and hunger to the bigger and wider issues that all countries face around their environmental challenges, climate, the durability and the viability of soils, of health of our oceans. This is a big topic. At the same time, we saw, because of the impact of COVID, some quite worrying trends on basic levels of malnutrition and hunger, an increase in the absolute number of people suffering from hunger by over 100 million, continuing high levels of vitamin and mineral deficiencies, and an increase in the number of particularly children suffering from severe and acute malnutrition, really wiping out in 1 year, 10 years of progress in pushing those numbers down. So we have a big task before us. And of course, that task hasn't got any easier in the last 2 or 3 weeks. When we first planned this session, we had no idea that there'd be a war in Europe. This is a situation which David Beasley, the executive director of the World Food Programme, has said that the fallout from the Ukraine war will, spread across the entire globe. And we know that the people that most severely affected by malnutrition are the poorest people. And what we do know pretty much for sure from the fallout of the latest crisis is that the price of many staples will go up, and the cost of many inputs to agriculture, fertilizer and so on, will also go up. And this is going to put extreme pressure on the food system, and the pressure comes hardest on those who are most vulnerable. So what we're going to do today, looking at the likely trends here, which is that there will be more hungry people and there'll be more malnourished people on the globe, is look at what we can do to respond to these new challenges. So we've got three fantastic speakers with us today, Mark, Abdul and Iman. And what we're going to discuss really is not the big kind of political environment, the big political economy of the world, but the practical issues around making access to the kinds of interventions and treatments that are required for the most vulnerable children more accessible, more affordable, more practical. And that means looking at the realities of the partnerships between suppliers, health systems and donors, and the operations of these types of these types of value chains, and how we can make them more resilient to challenge by having them more localized and based in the communities that they serve. So that's the sort of backdrop. And I think what we're going to try and do is, first of all, give each of our contributors a chance to say a little bit about what they do in practice, and then focus a little bit on these challenges and opportunities that they see from their perspective. And I'm going to start, first of all, with you, Iman Abdul Karim. Can you just tell us a bit about where are you? Where are you sitting? What does your company do? What's your background?
Thank you very much, Steve, for the introduction, and thank you for allowing me to be part of this discussion. I am Iman Abdel Karim from Samil Industrial. It's a local producer of nutritional product located in Sudan, and we're producing from the heart of Sudan, which is Khartoum. Well, I must admit that the production, especially as you mentioned, over the past 2 years, has been not really easy as the demand is increasing and there is more need for nutritional product. And unfortunately, it is not decreasing as we have hoped to bring hunger to the ends by 2030. Um, yet we see that a lot of the demand or the need for nutritional solution is actually increasing, not only locally but also regionally. So we are operating in Sudan, which is it's considered a consuming a country of nutritional product, and well, we're still not able to fulfill the entire demand nationally, and not to mention the neighboring country that we could have also give them a hand with our production. So I'm representing Samil. Samil is a company that was established in early 2012 to produce nutritional solution, and it's a franchisee of the French company Nutriset, or Nutriset Group, and we are part of the Plumpy Fields member, which is a member of several producer worldwide that use the same technology and the same branding and specification in order to bring nutritional product in the country. And the reason of the establishment of the Plumpy Field is basically to bring or to make the production closer to the beneficiaries. So instead of having the product being shipped from where the international companies, mainly to have it closer to the area of production. So we have joined that effort since 2012, and I guess we did pretty well good. We started as a very small production facility that used to produce 1,200 metric ton, and today we're at producing production capacity of 10,000 metric ton. So I guess that's a huge development over the past 10 to 12 years, 10 years. We're at 2012. And throughout this, there has been a lot of changes. I mean, in nationally, but also regionally. Nationally, the country have been through mountainous stages, and I think it's very worth to mention that 2 years ago or 3 years ago, we had a revolution, and we were able to bring certain conflict in the country to an end, but yet the demand for nutritional products has remained, if not increased, over a period. Um, I guess our objective has not only been providing solution or for severely malnourished kids, but also to bring about other solutions that are required for the person with nutrition and need in general. We have been able to produce four different products. One that is used for severe acute malnutrition, one for moderate acute malnutrition, but also we have switched in recently to preventive product that's supposed to prevent malnutrition or uh, towards the prevention of malnutrition. Let me say it this way. And we have been trying very much to produce constantly and continuously with the demand that is out there. Yet, of course, like most producer in the field today, and especially our partner, local production has been struggling a lot. And I guess because producing locally, it's not cheaper. It's definitely not cheaper because we're still depending on raw material that has to cross oceans. But it's also not cheaper because not all the countries where we operate such an industry is actually supported or being looked at as an industry that is bringing a humanitarian product. So yes, we are not particularly taxed when it comes to raw material coming in, but we still are facing with the huge cost that is aligned with the production costs, fuel, transportation, electricity. It's been one of the major issues in these countries. In Sudan, particularly, we also faced an issue of sourcing of part of the raw material, and we try to really motivate the producer of at least some of the raw material. We are today producing 40% of raw material are sourced nationally, and 60% are coming from elsewhere. And that, of course, includes the powder milk, the nutrients, and other a bit more sophisticated, I would say, or expensive material that are not being able to be produced locally. And so, however, whatever is being produced locally, such as the groundnuts and some of the packing material, etc., we have been really motivating the local producer to produce. So we also aligned a lot with the local producer to be able to produce quality and quantity, good quality product, and in a good volume that we could benefit from. And so we allied with farmers. Eventually, we created another facility or processing facility to process groundnut, and in order to also bring more value to the farmers and not having it to go through middle persons or brokers. So we did all type of efforts in order to really motivate farmers to produce better, and also to produce the quality that adhere to the international standard that we are using. One of the Again, some of the challenges we have also faced with trying to work with the farmers, or even the job we have created, we're not able to sustain them because, well, we are, when it's come to the business itself, local producer are not being given the full opportunity to produce. I mean, if we were able to produce more, we would be able to cut on the cost that has been a burden that comes from the various areas. And we feel very much as a local producer, and here I'm also speaking of my other partners within the plumpy field. We have really been disregarded when it's come to like big volumes or major productions, orders from the, whether it's being UN agencies or INGOs, because at last they look at price, and price is something that we're trying very hard to work on. But if we were to produce much more, we would be able to cut on the cost. What we have been thinking all together, I guess it would be very it will benefit or support us a lot if a part of these international allocated um, volumes for production of ready-to-use therapeutic or supplementary food, it's also being given to local producer, mainly because it will help also impacting the economy of that particular organization operating. For example, in Sudan, we are talking today about over 1,000 farmers are being impacted by our program. We have over 250 direct jobs for people who are working in the factory today, and those also act as an ambassador for nutritional well-being, because they are trained, they're supported, and if you look at these maybe very small numbers, at least it's a start. So these are the things we hope to, through this platform, we have the voice um, of um, of donor, but also buyers and partners who all come together to combat malnutrition. These are some of the challenges I try to highlight. Of course, there are much more, and we can go more in deep, but we can bring that later in the discussion. But this is mainly where I'm from, what I'm doing today, and just try to reflect the image in which we are standing.
Thanks, Iman. That's a very inspiring story. So the issue of price and procurement mechanisms, let's park that. That's one we're going to come back to. I'm sure all three of you will want to talk about that. But now let's maybe, Mark, can we turn to you? You know, you've been in this field for, I think you said more than 3 decades. Can you explain a little bit about your work? I know you've been involved right since the beginning of IUTF, and how you see some of the challenges that that Eman referred to.
For sure. So my name is Mark Manieri, and I work with Project Peanut Butter. Project Peanut Butter is registered as a not-for-profit, but operates as a an entrepreneurial business. We are located in production in 4 countries, Malawi, Sierra Leone, Ghana, and Ivory Coast. And I'm a pediatrician, and so we have a strong interest not only in making foods and making foods healthy, as well as how they get distributed and used. So we play in all the different pots. We still had our first productions were in the end of 2001 in Malawi. So we've been making food since that point in time. And all of our production facilities focus on these peanut paste-based foods where you take peanut paste and you're mixing other kinds of dry ingredients into them. So that is, I'm the only expatriate face you'll see in the whole organization. So that these are all entirely locally registered NGOs with their consummate struggles and battles in that way. So that is a little bit about what we do. We have probably 150 employees, and we are probably making, I would say, some thousands of tons of ready-to-use therapeutic food or food aid products. When I think about what the challenges are, I will raise a few issues here. One is we have this label humanitarian crisis. Well, this is a continuum. Okay, I know that there's a line somewhere with the policymakers and the people that respond that say a crisis, is when it crosses this line. But you can't build institutions and organizations only for work in a crisis. And I think Iman emphasized this as well. If you want these local responders to be there when there's a problem, you need to do a couple of things. They need to be working on continuously, maybe not at the highest levels that they are in a true crisis, but they have to be. It has to be a machine that works. It can't be go out in your yard. This car's never been started for 2 years. Now we're going to try to drive it on a long trip. That's hard. That doesn't work. And there are inputs into the foods, particularly the imported inputs, which I think are quite a challenge to respond to in a very short period of time. So if you go to try to buy micronutrients, you will be told, yes, we'll take your order. It's no problem. We'll start production in 3 months. So, I mean, one, sort of very practical point is I'd say, let's do something about these very long-term lead times that really handcuff a local producer. Whereas the handful of very large producers have these ingredients in stock, and they just sort of shift them over from other kinds of orders to this. And then I also, I know this is a wish list thing that isn't really easy to deal with, but local tariffs and local clearing mechanisms are very, very cumbersome, because at Project Peanut Butter, over 75% of the inputs into our UTF are obtained locally, are grown locally. We work with peanut farmers. We use sugar that's made locally, But that's still that other 25% you can't make the food if you don't have it. And having things tied up in ports, having large tariffs on these kind of things are barriers, that do not allow me to respond in a timely manner. So and then what I want to say on the positive side, because I really need to say that I think this is a very tremendous positive opportunity. You heard a few complaints from me just now, but on the positive side, I can provide you with a much more secure local supply chain. I can beat you on that any day, because I have storerooms and I have a staff and a security mechanism in place. And food is gold in these kind of crises. It is a very valuable thing, and there's going to have these security issues surrounding the storage and delivery of the food. And that's what a real a local responder can actually do. In the case of Project Peanut Butter, you know, we talked a bit about, you know, having a company or a food producer sort of being like, you know, not part of the main conversation. But if this is what your program is hinging on, then put me at the table when you're doing your planning, and have considerations in place to support that in the same way that you would have considerations with, you know, if in a crisis, if there's a health service delivery and you know you're going to need a lot more health workers, you may have to figure out some kind of response, and you may put some inputs from the outside, from the EU, wherever, to address those. And as a local producer, I'm going to need that kind of help too at times. So put me at the table. You don't know anything about my needs and barriers. Maybe they could be alleviated. Maybe I have solutions for you that you haven't thought of in terms of the supply chain, the delivery. I mean, the whole construction of the supply chain of these food aid products is ancient, and that isn't a good thing. That's not a compliment. You know, I mean, they involve keeping these products for long periods of time in warehouses and then distributing them. What does the modern supply chain look like that Toyota revolutionized? They're trying to deliver stuff when it's needed and not necessarily before. And a local producer can really help you along those lines. And the other presenters here with me, Iman and Abubakar, are right in the middle of crises. I mean, they are hands-on and close to these kinds of crises, and could provide very, very valuable, better service in that kind of way. I also think we need a little bit of an opportunity to use a more variety of products. Okay, the governing figures, if you want to call them that, in terms of the UN agencies, I'll blame them, but some of the also governmental agencies have straitjacketed the World Food Program to just a very few different products. And for instance, what about a product that provides, you know, essential amino acids and micronutrients, something that can turn a bowl of rice porridge into a packet of RUTF? This is something that can be developed. It does not require high technology or magic. Why can't we have something like this around too? Anyway, I don't know if that's enough time, Steve, so I'm going to stop and be happy to interact later.
Yeah, I think so. I mean, one thing emerging, two kind of things emerging from the first two presentations. I think first that, you know, humanitarian crisis, yes, but in terms of severe and acute malnutrition, it's a chronic crisis that's been there for decades, and it's not going to go away in the short term. I think that's really important. And the second is, you're both really arguing that, you know, price point is only one measure, and that the need to look at how you trade off, if you like, simple price point against other forms of benefits, you know, security of supply, closeness to the, you know, the better locally secured supply chains that can react potentially quicker than the global system. I think that's quite an important point, because you can understand how any donor wants to provide at the cheapest possible price the solution. But what you're both saying is that there's a cost to a low price, which can diminish the potential impact on the beneficiaries that you're trying to target. Anyway, I know that Abdulkader will talk a little bit about this from his own experience, particularly around the local supply chain. So Abdulkader, over to you. Tell us a bit about your company.
So my name is Abdulkader Bukhari Yonli. I'm the general manager of NutriCare Limited. NutriCare Limited is a subsidiary of Nutriset Group, and we are the last born of the Plumpyfield network. So the company has been established 2 years ago. Unfortunately, the first year we were in the, let's say, in the COVID-19 issue situation, and we lost something like 1 year to start the business. So we really started the production a few months ago, and lucky enough for you, things are moving on. In Nigeria, we can say the rate of the malnutrition is higher than all the other countries that we have in Africa because of the high population and also because of all the insecurity matters and also the insurgency in the northeast of the country. We in Nutrike, we are based in the north of Nigeria, in Kano. So Kano can be considered as the center of the north, and from Kano we can easily deliver within 24 to 48 hours all the states of Nigeria where you have the malnutrition. On another hand, we are close to the Niger Republic side border because we are just 3 hours from Niger and let's say 7 to 8 hours from Chad. Well, we are in the center of the Sahel, I can say like this, and all the neighboring countries like Niger, Chad, Cameroon has a huge rate of malnutrition. So from my own experience, since we started this business, one of the advantages that we have is the location because in the other side, when I used to see some of the UN organization or NGO who used to import this kind of RETF, and the timeline is something around 4 to 6 months, unfortunately, because during the last year, the issue of the shipping, the costing, also the time become worse and worse. So in our situation, and as a local manufacturing company, we use within 2 months to be able to supply. But one of the issue that we have also is, let's say the orders, the needs is not determined in advance. So sometimes you can have someone who can ask you to produce 10,000 carton while you have just 2 or 3,000 in your warehouse. So, and it's going to take time to respond to this kind of things. So those are the main challenges because I can understand that sometimes you cannot predict the rate of malnutrition in an area, but it will be good also as an industrial to have just an average and an idea of how is going to be the need in the next couple months, for example, to allow the manufacturer to be able to just adjust and to have a kind of forecast when he's producing something. Secondly, in our case in Nigeria, for example, we are facing a high duty rate when we are importing the raw material. Why? Because unfortunately, some of our countries are living with the duty, the taxes, and everything they used to have from the imported goods. So sometimes it's quite difficult, and also the leading time. When I'm talking about the leading time in our case, when we are expecting to have one container clear in a month, sometimes it can take 2 to 3 months just because of the bureaucracy sometimes and the lack of organization in the ports. Some challenges also on the currently, for example, we are facing in Nigeria in a shortage of fuel. And when times happen like this, you can have a high inflation in transportation, and also sometimes even to book a truck to bring you your goods in times will be quite difficult. So we have this definitely, but the good news also is when you are trying to work on the local raw material like the peanut, the sugar, the palm oil, the soya oil, you have some other advantages because with that you can book something and have it in 2 to 3 weeks. While you are importing, it's a question of cash flow, it's a question of shipping, it's a question of booking with the manufacturing. So those are the kind of things that we are facing. But for me, at the end of the day, in our case, when we are a local manufacturer, to be close to the beneficiaries is a huge advantage because in a case of emergency, when you have the stock available in your warehouse, within a month or 2 months, you can deliver and save life. While you are importing something, it's a question of month and month. So that's the thing that I can tell you regarding our business. I'm new in the business because we just started the things in just 1 year ago, but things are moving smoothly and we start to be a little bit more reactive than when you are importing the goods from outside. In the case of the finished good, that's all.
Okay, thanks all of you. That was fascinating discussion. I want us to go into a little bit more detail on 2 or 3 of the big themes that seem to me to emerge from your responses. The first one is really, I mean, obviously, these products need to be good quality and they need to be safe. But are the regulatory arrangements around getting to those goals, are they well aligned with the needs of localized production? I don't know whether, Mark, maybe you could offer us I mean, you are a pediatrician, so you have some medical knowledge here. Are these regulations what you might say really fit for purpose?
I don't think so, and I think this is an opportunity for the international community to really increase availability and increase the value of the food aid. So in particular, you know, I would say the risk-based analysis is what's important. You know, when you have a regulation that says you don't or you must, what's the risk of not complying with that? And keep the emphasis on the most important risks. Okay, so a very minor contaminant that you know would only pose a threat to health if consumed over decades worth of time probably needs to be considered as a very, very low risk. Rather, some of our sort of our core legumes and cereals that are procured locally, we need to put a higher risk on that.
So you're saying you think that the risk, the assessment methods, as well as the risk profiles, in some cases are overly complex or unnecessary.
Yes, I'm saying that risk is not figured into that equation. It's just said like do this, do this, do this, do this, and when the list got too long and you couldn't do them all anyway, the list just keeps getting longer and longer and longer. So focus on what's really important. You're going to get the job done that way.
Okay, cool. Iman, do you agree with that?
Yes, I agree with that, and again, I'm not from the medical field, but I very much understand the quality assurance of the raw material that we are trying to put into this. But what I'm really questioning is the quality control of the finished product. I mean, the process to go through it or the procedure to go through it. I mean, it is putting the business a bit more in burden, since we're talking about cost, or we've talked and all of us have mentioned the matter of cost. um so that long quality control procedure kind of also hindered the process, which is will add cost, making the product at last more expensive, and most likely also delaying um, the product being out there for the beneficiary. So these, from a practical point of view, these are things we have been facing, but most of our partner also been facing, and maybe we need to revisit the quality control.
Yeah. Abdul, you know, in the earlier discussion, we talked a lot about price. I mean, obviously, price is very important, and you want to keep price as low as you can. But we also heard a lot about the non-tariff barriers and the financial barriers that local production faces that could be changed. And I wonder if you could maybe share with us a little bit of your thinking. Supposing you were, instead of being producer of this product, were sitting in the Ministry of Finance in Nigeria, and you were looking at, you know, what are the potential benefits of a local industry producing this? We know, of course, local production will have many other advantages, but purely from a kind of economic point of view, what would you, if you were in charge of that, what would you do differently in Nigeria to make it easier for you to produce locally?
Good question. So for me, first of all, when you have a new factory or new business like our own that can be set up in a country, first of all, for the first 2, 3, or 5 years, you should give them the opportunity, let's say, to have a waiver on the taxes. I know that most of the countries, they don't want to hear this kind of things, but at least to start a business, we need to have this kind of facility. Why? Because investing in the equipment regarding the high level of quality expecting from the customers is not easy to have it. Secondly, when you start a business, in our case, for example, finding the local peanut free of aflatoxin in the beginning was really, really difficult. So from the government side, it's insane. It's a nonsense to hear that someone is importing the peanut from abroad while they have it in the country. And when you talk about the aflatoxin for them, it's not something true. You have to show them that it's a reality. So in the beginning, you have to let's say match the requirement of the customer in terms of aflatoxin rate, but you don't have it in the country. It's a long process to train the farmers, to explain them that they have to work in this kind of quality requirement to reach the level of aflatoxin. And you have the government that cannot understand that peanut is producing in a country, and why are you importing it? And they want to protect their industry, their farmers. So before having even the waiver to import this kind of peanut in the beginning, it's a quite difficult. For me, the environment of the business in the beginning, especially when you are a pioneer in this kind of business, you should have 1, 2, or 3 years to let you set up your company as you are expecting. Training the farmers, having the waivers, and give you the good environment in terms of, even sometimes you can have some discrepancies between the local regulation in terms of quality and what even your customer is asking you. Sometimes even the standard is not in the country. In our case, for example, we are sponsoring the standard of RETF in the country because nothing is existing. And when you compare, for example, the legal rate of vitamin A in the food and what is required in the RETF, you have some discrepancies. So you need to let them understand that there are some international standards that they have to follow. And it's a long process, but while you are in an emergency situation, sometimes to convince the authority to give you this kind of facility is quite challenging.
But I think that's right. My question was also more about, does the system for procurement take into account, if you focus so mainly on price and quality, which is correct, you have to do that. But, the localization argument also for a government is about generating jobs and income and livelihoods for the country, as opposed to those jobs being somewhere else through and the product being imported. Do you feel that, any of you, do you feel the governments in the countries you work with kind of get this potential advantage of building a local industry to supply these needs? Is that something you sense from Sudan or Malawi?
I mean, there's certainly an appreciation, and that is one of the key elements of government considerations. And so I think that in general, there is kind of a disconnect between donors and perhaps outside implementers and local governments. We see this disconnect particularly in that most countries have a Bureau of Standards which certify food producers in those countries. Let's engage that system. Right, currently for RUTF, for example, that system comes from Copenhagen. The inspections, the rules, everything exists completely apart from the FDA's. There needs to be some kind of melding, and somebody might claim it's a compromise, but it's a good compromise.
Yeah. Iman, did you want to add anything there?
Yeah, I guess I wanted to really add what I wanted to add is similar to what Abu Bakr have mentioned. I mean, and Mark as well. This specification has been put in countries or in places in other nations where it doesn't always go along with the country specification, like very similar to what Abu Bakr has saying. So many of the countries where we are trying in Sudan, for example, we also supported the local government to come up with like the specification, and they had to build on what the UN has put, which is being Copenhagen or Rome for WFE. So and then they adopt this very high standard that are not existing or were not existing before. and creating even more pressure for us to produce locally, because we have to adhere to this specification, and that's quite a hinder.
Yeah, so what we have here is quite a complex picture. So we're looking from the beginning kind of on how does a small medium enterprise or an NGO produce locally? And it's quite clear that the factors that would encourage that and would have quite a lot of significant benefits, I mean, not just in terms of local employment and livelihoods, but actually in terms of the ability to deliver what's needed quickly in a secure way to beneficiary populations, rather than very long in terms of time and distance procurement supply chains. This is quite a complex issue. It's about local conditions, and maybe it sounds as though if you listen to the three of you talking, you don't really feel the international organizations and donors really understand how to foster the development of this. You feel a little bit, that your voice isn't being heard. Maybe I'm projecting that too strongly, but that's what I'm hearing. So I think this has been a great session. I wanted to, in the end, move towards closure by asking each of you really to come up with the one thing that you feel would be most important as a message to the conference that this dialogue's for, which is around humanitarian assistance. It's a big event in the EU with lots of players, deliverers, and so on. What is the one thing you would say they could do to most contribute to the development of the kind of initiatives you've all been working on over the past years? Can I start maybe with you, Mark?
Sure. I mean, if you think about the advantages for commerce and connectivity that the EU has, could the AU in sub-Saharan Africa also, coordinate something, something similar? I mean, then an emergency is not located in a country of X size with a giant border and wall around it, and everything has to be doing with this government and then this government and this government. What about some general rules for humanitarian crises?
Thanks. Abdul Kader.
From my side, what I can say definitely is local production has a lot of advantages. When we are talking about saving lives, it's not just the malnourished children that we are saving. We are saving a whole network. No, I don't like the term network, but stakeholders, from the beneficiaries to the population, farmers, employees, the training. We have a whole value chain that we should take in consideration in our case. And those are the huge advantages that we have to emphasize first, I think.
Thanks. Iman.
Yeah, I guess what I wanted to mention that this local producer also act like an ambassador, right, for nutritional solution. And I mean, um, maybe you also need to maybe this big organization also need to understand the nature in the country where the local producer actually are. And once you have a global understanding of like the different region, etc., then it makes it much easier to judge and to put classification, because as we are working today, it is just like a theory being adapted and has to be adapted by everyone eventually. And then what, as Abdul Bakr has said, one has to look at what we are trying to do here. We're not only trying to sell product, but we're also trying to save life of people. And this saving of life, it is beyond just to look at it on a theoretical perspective, or also to look at it from a business point of view. It is just beyond that, and maybe we need to read beyond the line and try to also put these things into consideration.
Yeah, thanks. It's been a privilege to listen to the three of you. I think we've had the opportunity to listen to some very authentic voices on this problem and on the opportunities here. So I hope that, for those who've joined this session and listened in, the contributions will help build to the next steps of strengthening the capacity, resilience, and local ownership for solutions around these problems of malnutrition. So I'd like to thank Nutriset for helping to arrange this jointly with GAIN for the session today, and a big thanks to each of the three of you for sharing your experience, your ideas, and your vision with us. So thank you very much.
You're most welcome.
You're welcome.